Hello, Professor Bell and class. My name is Jennifer Heiser, and I will be speaking about the role of the patient in continuous quality improvement, or CQI. While it is vitally important that all employees of healthcare organizations are focused on quality improvement, it is also important for employees to get the customers, or in the case of healthcare, the patients, involved in quality improvement as well. Ways for patients to play a role in CQI include gaining knowledge about their own healthcare and showing empathy to other patients while in the healthcare setting. As Davis and Ghosh, 2016, made clear, the customer knows much more about his needs and wants than the organization does. However, it is important for healthcare organizations to ensure that their customers or patients are knowledgeable of all aspects of their particular situation. While the patient knows what he is going through with his condition, he may not know the medical reasons or the causes for it. Communication between physicians and patients can help patients make more informed decisions for their care. Zani, 2017. An important role of the patient in quality improvement is to use resources given to him in order to make these informed decisions. Informed consent is communication between the patient and his doctor that allows the patient enough information to decide whether to undergo a particular medical treatment or procedure. Zani, 2017. When a patient is not knowledgeable of his situation, it is important for him to ask questions of the physician and, if this is not enough, to seek a second opinion where necessary. In the words of Dr. Salome Shitavi, the project director of the Division of Healthcare Quality Evaluation within the Joint Commission, it is important that informed consent is more than just a signature on a form. Zani, 2017. Healthcare employees must remember, however, that with informed consent comes a potential for a refusal of care. In a research study of primary care published by Implementation Science, the majority of physicians could report a resistance of patients to a diagnosis and treatment of depression. While it is well within the rights of a competent patient to refuse care, it is important that patients receive as much information about risks and benefits of treatment as possible. In order for patients to be considered capable of making healthcare choices, they must be educated on the relevant healthcare issues. Too often, a patient will have an idea of a particular medical diagnosis or a stigma, and they will refuse treatment on this basis alone. In order to truly play a role in quality improvement, patients must be willing to listen to doctors about the true nature of a disease or ailment in order to make an informed decision. Another role of the patient in continuous quality improvement is to speak and act properly in specific situations. Something as simple as the return of a smile can mean a great deal to another person. Carroll, 2013. While it is not each individual patient's responsibility to help one another cope with a personal situation, it is often very helpful for patients to relate to one another, even with something as simple as a shared smile. I'm sure many of us have experienced a time where we smiled at someone and had it ignored. Whatever personal issue patients are going through, in order to play a positive role in continuous quality improvement, they must remember that others are important as well and deserve at least a light bit of acknowledgement. How much does it really cost to return a smile or to even say hello? Healthcare organizations can promote empathy and politeness between patients by making the environment a calm setting. Healthcare organizations can make the seating comfortable, offer entertainment, and lower wait times, all of which can improve the mood of the patients in the waiting room. Also, all staff must be trained to stay professional and polite, not only with patients, but also with other staff, at least when in patient earshot. A generalized expectation of politeness can go a long way in improving the overall quality of a healthcare organization. In conclusion, patients should play a major role in continuous quality improvement of healthcare organizations. Patients should always be educated enough to make informed decisions about their healthcare. Patients should be willing to at least listen to the healthcare provider about a diagnosis before declining treatment, because there is a considerable risk that they do not know all the facts. It is always acceptable to decline treatment, but to improve their own quality of care, they should at least hear what the doctor wishes to inform them. Patients can also play a role in the quality of another patient's health care by simply remaining polite and pleasant to those around them. A simple act of returning a smile to another person can be a factor in the quality of someone's health care. There are many ways to participate in the quality improvement process, and patients have just as many opportunities to do so as healthcare workers.